Hi, everybody. Welcome to all of the Lobby Day 2016 participants. Thanks for tuning in to this webinar. We're so glad that you'll be joining us for Lobby Day on the 31st of March this year. And we're really glad that you're preparing for that day with these webinars with us. So to start off, we're going to have some background today on the Each Woman Act and generally on meeting with your legislators and reproductive health lobbying. So we're really excited to have with us today Dr. Pratima Gupta from and Gerald Hayes from Physicians for Reproductive Health. Pratima Gupta is the Reproductive Health Advocacy Fellow at Physicians for Reproductive Health, and Gerald Hayes is the Assistant Director of Public Policy. Dr. Gupta is going to start us off with some general information on meeting with your legislators, and then Gerald Hayes is going to continue with some more specific information on the topic that we'll be covering for Lobby Day. So with that, I'll let you guys get started.
Great. Thank you so much, Allison. So I'm an obstetrician gynecologist practicing in the Bay Area currently, and I've done several Lobby Days both in Sacramento and in Washington, D.C., and each one varies. And I think the number one thing to remember is to just have fun with it and to be flexible and just, see where the day takes you. So I want to give you all some tips about meeting with your legislator as future physicians, and specifically some tips about how to lobby around reproductive health issues, because it can be tricky depending on your audience. So, you all as future physicians, you really have very unique voices as physician advocates. People realize you are the future of medicine. Your voice carries a lot of weight, and people want to listen to you. They care what you have to say. Your dedication, your passion, your intelligence are obvious. So you are considered qualified medical experts. People understand the extent of the work that is involved in order to become a doctor. There's no question. People know how much you've done to go through your undergraduate training. Now in your medical school training and the number of hours you've spent in physiology, in the gross anatomy lab, on the wards, and legislators, their staff, they understand that and they truly respect that. And they're especially appreciative that you're taking time out of your busy academic curriculum to come and talk to them about an issue that is important to you. So they understand that future physicians, they're advocating not just for themselves and the kind of practice that you're going to have, whether it involves advocating around reimbursement or around insurance coverage. You're going to advocate for your patients and in their access to care. And you're also going to advocate for your community and to ensure better health for your community in general. So you are a future physician, and people know that. You are not a lobbyist. You're not going to expect to be as polished or as, it's okay. Basically what I'm trying to say is it's okay if you stumble over your words or, want to start over and start from scratch, because they know that your focus and your primary duty and responsibility is to be a medical student. It's not to be a politician. It's not to be a lobbyist. And that's okay and much appreciated. I mean, as you can see in this picture, you have Obama here greeting physicians at the White House. And, that white coat and the respect of it really carries a lot of weight and goes a long way. So there's many different ways that you all as future physicians can influence policy. So the first would be providing testimony to a legislator in a court, if it's requested of you, or you can even offer yourself up as a resource. You can educate your legislators and their staff members. Frankly, there are not very many doctors in politics, and so they don't have a great grasp of medical issues. So even just some basic education is oftentimes needed for the legislators and their staff members around why these issues are important, why they're going to affect them and care about them and their constituents too. It's also important to visit your legislators, write them, call them. I mean, they are obligated to read every single piece of mail they receive, especially the handwritten ones carry a lot more weight. They're obligated to take every call, especially if you're a constituent. So if there is a specific vote that is coming up, that's an excellent time to make a special effort to reach out to your legislator and make sure you know who your legislator is and tell them that you are a future physician and this is why they should vote a certain way on a specific issue. It's important when you meet with your legislators to follow up with them if they request more information, additional studies, additional research, clarification. So make sure you do follow up. You know, if you don't know the answer, it's okay to say, I don't know, but I can follow up with you and give you that information, give you that answer, but make sure you do it. You know, you don't want to lose your credibility by not doing that. Excuse me. It's also important to thank your legislators for positive votes. You know, before you go meet with your legislators on your lobby day, you will have done your research and know how your various legislators stand on each vote act. So it's important to thank them if they have voted in favor of these issues in the past. If they are some of our reproductive health advocates, thank them for that. Sorry about that. Okay. Next. So in preparing for your congressional visit, you know, you'll meet with your team of other medical students. You're going to make a decision about your strategy, how you want to approach them to go through the various talking points of the Each Woman Act, the various issues, depending on who your audience is. And it's great to practice what you have to say. You're not going to sound, you know, it's not going to sound canned or rehearsed, but it's better to practice with each other before you go in there so that you don't, you're prepared but not overly polished. And so that's okay to practice and it's encouraged. And don't worry if you meet with a staff member versus a legislator. Frankly, most of the time you'll probably meet with one of their staff members rather than the legislator themselves, and that's okay. A lot of people get disappointed when they're, like, you know, not meeting with an elected official themselves, but they're rarely the experts on every single issue. There's way too many things for them to keep track of. So that's why they have the staff members who are specialized on healthcare, environment, you know, technology, whatever the specific issue is. The staff members keep the details of the various issues and really are really influential and have significant influence on the legislator and how they're going to vote. Oftentimes, the legislator just can't keep track of everything, and they'll ask the staff member, how should I vote on this particular issue when it comes to the floor? And you would really carry a lot of weight if you made a connection with that staff member and convince them. The other thing it's important to do is remember, you're going to have a schedule for the day and respect people's time that they're doing to meet with you. So you be prompt for your appointments, but sometimes you'll show there, they might have you wait for a little bit. So just to be patient, be flexible. They might have you meet in the hallway. They might not have you have a table with enough space for you too. So just be flexible if you're meeting in a, you know, less than ideal situation. Next, it's important to keep a positive attitude in terms of your meeting. You know, you're going to be meeting with legislators from all different backgrounds and experiences and parties. And so keep a positive attitude, no matter what their response is, no matter if they say, yes, I'm going to vote in favor of the Each Woman Act, or it doesn't really sound like it's my thing, or I need more information. Don't get discouraged. You need to be persuasive to them. Use your evidence. Use the fact that you are medical experts to be persuasive and give them, you know, medical stories and examples that will persuade them, but don't be argumentative if they challenge you. Be concise, be respectful in their time, so you don't want to just go on and drag on. And like I said, if you don't know the answer to a question that they ask you, don't guess. Just say, you know, I'm sorry, I don't know, but I can look it up for you, and then make sure you do indeed follow up with them. So at your congressional visit, definitely wear your white coat. I know a lot of us sometimes feel like it's kind of cheesy to wear a white coat. We don't like to wear it outside of the hospital. But make sure you do wear it. It actually carries a lot of weight. People understand what the white coat symbolizes. Make sure you have a clean white coat as well, not one that has coffee stains. Thank them for meeting with you right at the beginning. especially also if they are someone who has voted in favor of reproductive health issues in the past. You can thank them specifically and say, thank you so much for voting on blah, 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 blah. And that carries a lot of weight because you've done your research and you know that this person might have 100% rating by NARAL or something like that. So do your research on who you're meeting with and thank them, especially if it's something specific for the reproductive health voting record in the past. Introduce yourself and your title. So you could say, my name is Kelly, I'm a medical student at this institution, or I'm one of your constituents. If you are indeed one of the constituents, make sure they know that. Carries a lot of weight if you're meeting with one of your constituents. If you are a vet, make sure you tell them that. Things that are real, a Peace Corps volunteer, something that can make a connection with whoever you're meeting with, that can carry a lot of weight. So make sure you can slip that in. And then move straight away to the talking points. You should meet, before each meeting with your legislator, you should have a little huddle and decide who's going to lead the meeting. Ideally, if you have a constituent in your group, they should lead the meeting and they should open it up. And then you can kind of decide who will go next, who will tell some patient stories. But before you walk into each visit, you should prep by having a game plan as to what order you're going to talk, and really make sure that each person in the group says at least a little something, because otherwise you're just sitting there and a staff member of the legislator is going to kind of wonder, well, who is this body that has nothing to say? So make sure that each person speaks and that you have a little bit of a game plan about what order you're going to speak in. So patient stories. It's really important to create a connection when you are communicating about reproductive health. The patient stories are so important. So if you haven't started doing this already, I highly encourage you all to start a little journal or a blog, writing down patient stories that you see as you go along through the wards or through your critical medicine courses, and keeping track of them. Obviously with no identifying patient information, but just to keep track of some of the details of some of the stories. I mean, you all are coming to medical schools around the country and have a vast array of different experiences that you're going through with patients that you're seeing. So any kind of story that might move you, whether it's about reproductive health or not, start jotting it down. And then when you go to an experience like this, like a lobby day, then you can pull out some of those stories. Always tell a story and focus on sort of the bigger picture and the patient and their specific circumstances. Providing a few details of the story are nice, like, she, was a 26-year-old woman who came in tennis shoes because she had walked 3 miles to her appointment or something like that. A few details are great, but not an excessive amount, because you do want to be concise and respectful of people's time. Also, avoid using any medical jargon. Like I said, we all are medical experts, but nearly no one you're meeting with will be a medical expert too. So you don't want to use, acronyms like PTL. You want to say preterm labor. You don't want to be too jargony, and you don't want to be too graphic. We all can handle blood and vaginal discharge and sputum, but most people, the average person, that's not necessarily office talk for them. So, like I said, you want to rely on everyday language and some patient details. And really let your passion show. Obviously, this story stuck with you for a reason. You need to tie it back to the talking points and why you're specific, but obviously it moved you enough that you wanted to relay it to the staff member or the legislator. So it's okay if the story brought you to tears, and it's okay if you cry in the office. It's okay if you don't have a story of your own, you can borrow one from a colleague and just say, my patient, a colleague of mine saw a patient who blah, 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 and that's as well. But just patient stories are really, really powerful. So here are a couple examples of patient stories. Here, this is a 24-year-old woman. She had 2 children. She was pregnant and wanted an abortion so she could focus time on her family. She delayed seeking care because she needed to save up enough money and sick time to cover the cost of her abortion and the child care that she needed. So you can sort of, pause there and then say, put yourself in her shoes for a second, juggling a job and young children and trying to do what is right and best for your family. And that's quite powerful because it demonstrates, the specifics of this woman's situation, what she had to sort of juggle with and what she has to go through in order to get where she is today and the challenges that she had to endure. So this is what we call a message box. So this, you'll get these slides, and this message box kind of goes through why we want to really, the message in the middle is supporting a woman's well-being. And if you look at the key points on each message, the first is, every patient is unique, every situation is different. And then there's subtopics, restrictive legislation, threatens women's health, whatever our personal feelings doesn't justify taking away a woman's options, and patient safety is my #1 priority. So frankly, almost any question that somebody is going to ask you about the Each Woman Act, you can refer to this message box and use one of these messages. Because really what we want to ensure and make sure that all of our legislators understand is the reason why we're here is really to support a woman's well-being. And these are some examples of how we want to do that. You're going to be meeting with a variety of legislators. They're going to have varying stances on reproductive health and reproductive choices. So you could meet with a solidly pro-choice legislator who are champions and our allies, and it'll be sort of like a love fest. And at that point, you can still talk to them, still use your messaging, still use your patient stories, but make sure you thank them for their support in the past. And, don't take it for granted. We might need somebody who thinks choice. Depending on certain issues, they might vote in favor of choice, other ones they might not. And then that's where your voice, you can really convince them and be persuasive in terms of your arguments about why the Each Woman Act is really important. Or you might need somebody who's anti-choice, who consistently has voted against reproductive health issues and choice issues. And that's a challenge, but don't get frustrated, don't give up, don't be argumentative. Simply state your point, explain Each Woman Act, explain the importance, and really continue to use your patient stories. It's still a good practice, good experience. It's a real challenge to convince these individuals, but it doesn't mean it's futile to meet with them by any way. And finally, when you end the congressional visit, if it was supportive and they were appreciative of what you have to say about the Each Woman Act, they thank them for their continued support and let them know you look forward to them continuing to be a champion on the floor, encourage them to really talk to their colleagues, and hopefully make them as supportive. If they're undecided and sort of in the mushy middle, you can urge them to vote the right way on the Each Woman Act, offer them resources to be continued dialogue. If they need any additional information, any additional patient stories, it's a good time when you want to give them their contact information, follow up with them, and just offer to be a resource. Often, especially if you're a constituent, they might follow up with you if they want to hear. And people, there have been times where legislators have actually relayed our patient stories when they're on the floor. So those are the things that carry a lot of weight when they're talking amongst each other. If they've heard these stories, then they might pass them along to their colleagues and use them to sway their votes.
Well, thank you so much, Pratima, for that nice overview of speaking with our legislators and some strategies we can use on the Hill. That's going to be really useful for us.